Indication: Remicade, Infliximab, can reduce signs and symptoms, induce and maintain remission, promote intestinal healing, and reduce or stop the need for steroids in adult patients with moderately to severely active ulcerative colitis who haven't responded well to other therapies. Selected important safety information. Remicade can lower your ability to fight infections. Serious and sometimes fatal events can occur. There have been reports of serious infections, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that have spread throughout the body. Lymphoma, including a fatal kind called hepatosplenic T-cell lymphoma, and other cancers have been reported in children and adults taking Remicade. Some people with heart failure should not take Remicade. Other serious side effects reported include skin cancer, hepatitis B, liver injury, blood problems, allergic reactions, nervous system problems, or lupus-like syndrome. To learn more about these and other risks, please read or watch the important safety information video and read the medication guide available on this website and talk with your doctor.
When I was in the hospital for 10 days due to symptoms of my ulcerative colitis, they put me on steroids again through the IV, and I was not getting any better. I just kept bleeding and getting worse and worse. The pain was not going away, and that's when my doctor approached me and told me about Remicade. And we just need to do some tests, and if those tests go well, then you're on your way and it should help you. When my doctor told me about Remicade, he was kind enough to print out a bunch of information telling me all the side effects and the benefits and the safety measures. He also gave me brochures. I was a little nervous knowing that I would need to take this drug to feel better, but I was hopeful. When I was in the hospital, we decided to go forth with Remicade. They had to give me a couple of tests, and then they started the infusion. They would watch me to make sure, my vitals were stable and that no allergic reactions were happening. And they watched me for that whole time. Where I get my infusions is a great infusion center. It only takes about 2 hours. And in that time, I can watch TV, read a book, or I usually sneak a nap. I only have to go in every 8 weeks. Fitting in my infusions every 8 weeks is just like anyone else, maybe having to go to a dentist appointment or any other doctor appointment. If I met someone that was having similar symptoms as I was before I was on Remicade and they had no relief from anything, I would definitely recommend Remicade. I had started Remicade and it actually put me in remission after 4 years of symptoms of having cramping and running to the bathroom. You don't have to have that pain. You don't have to worry about where the bathroom is when you go any place. Before Remicade, I had no control whatsoever in my life. I had to give up everything I enjoyed. Now with Remicade, I'm spontaneous again. I can travel, I can ride my horse. I feel like I'm back. I'm back to myself.
Important safety information. Only your doctor can recommend a course of treatment after checking your health condition. Remicade, Infliximab, can cause serious side effects such as lowering your ability to fight infections. Some patients, especially those 65 years and older, have had serious infections caused by viruses, fungi, or bacteria that have spread throughout the body, including tuberculosis, TB, and histoplasmosis. Some of these infections have been fatal. Your doctor should monitor you closely for signs and symptoms of TB during treatment with Remicade. Unusual cancers have been reported in children and teenage patients taking TNF blocker medicines. Hepatosplenic T-cell lymphoma, a rare form of fatal lymphoma, has occurred mostly in teenage or young adult males with Crohn's disease or ulcerative colitis who are taking Remicade and azathioprine or 6-mercaptopurine. For children and adults taking TNF blockers, including Remicade, the chances of getting lymphoma or other cancers may increase. You should discuss any concerns about your health and medical care with your doctor. What should I tell my doctor before I take Remicade? You should let your doctor know if you have or ever had any of the following: tuberculosis, TB, or have been near someone who has TB. Your doctor will check you for TB with a skin test. If you have latent, inactive TB, you will begin TB treatment before you start Remicade. lived in a region where certain fungal infections like histoplasmosis or coccidioidomycosis are common. Infections that keep coming back have diabetes or an immune system problem, any type of cancer or risk factor for developing cancer, for example, chronic obstructive pulmonary disease, COPD, or had phototherapy for psoriasis, heart failure, or any heart condition. Many people with heart failure should not take Remicade. Hepatitis B virus, HBV infection, or think you may be a carrier of HBV. Your doctor will test you for HBV. Nervous system disorders like multiple sclerosis or Guillain-Barré syndrome. Also tell your doctor if you use the medicines Kineret, anakinra, Orencia, abatacept, or Actemra, tocilizumab, or other medicines called biologics used to treat the same problems as Remicade. Are pregnant, plan to become pregnant, are breastfeeding, or have a baby and were using Remicade during your pregnancy. Tell your baby's doctor about your Remicade use before the baby receives any vaccine because of an increased risk of infection for up to 6 months after your last dose of Remicade you received during your pregnancy. Recently received or are scheduled to receive a vaccine. Adults and children taking Remicade should not receive live vaccines or treatment with a weakened bacteria such as BCG for bladder cancer while taking Remicade. What should I watch for and talk to my doctor about before or while taking Remicade? The following serious, sometimes fatal side effects have been reported in people taking Remicade. You should tell your doctor right away if you have any of the signs listed below. Infections like TB, blood infections, pneumonia, fever, tiredness, cough, flu, or warm, red, or painful skin, or any open sores. Remicade can make you more likely to get an infection or make any infection that you have worse. Lymphoma or any other cancers in adults and children. Skin cancer, any changes in or growths on your skin. Heart failure, new or worsening symptoms such as shortness of breath, swelling of your ankles or feet, or sudden weight gain. Reactivation of HBV, feeling unwell, poor appetite, tiredness, fever, skin rash, and/or joint pain. Liver injury, jaundice, yellow skin and eyes, dark brown urine, right-sided abdominal pain, fever or severe tiredness. Blood disorders, fever that doesn't go away, bruising, bleeding, or severe paleness. Nervous system disorders, numbness, weakness, tingling, changes in your vision, or seizures. Allergic reactions during or after the infusion, hives, difficulty breathing, chest pain, high or low blood pressure, swelling of face and hands, and fever or chills. Lupus-like syndrome, chest discomfort or pain that does not go away, shortness of breath, joint pain, rash on the cheeks or arms that gets worse in the sun. The more common side effects with Remicade are respiratory infections that may include sinus infections and sore throat, headache, rash, coughing, and stomach pain. Psoriasis, new or worsening psoriasis, such as red scaly patches or raised bumps on the skin that are filled with pus. Please read the medication guide for Remicade available on Remicade.com and discuss it with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.